This is Sunnyside on 95.1 Nigeria Info.
Okay, always a pleasure to have you. Stay here. It's 95.1 Nigeria Info. Right now, studio time check is 3 minutes past 1 o'clock. Hope your day is going good. It's a beautiful Thursday, and I hope your day and your work is making meaningful progress. If not, you better get up and start meeting up with those deadlines and doing the things you need to do. Sometimes we know what we need to do and we just stall on it. You know, procrastination is a big thief, so don't let it take over you, okay? I just thought to chip that in for anyone who may need to hear that. Now, yesterday was World Drug Day. Every year, 26th of June is always celebrated as World Drug Day, and it gives an opportunity for individuals, organizations, society, countries, nations, you know, to just step back and look within themselves. You know, issues of drug abuse are very big ones, you know, very, very big issues that costs nations billions in dollars, you know, and also it also destroys, you know, the youthful, not just the youthful part of the society, but like a large segment of society. So it's a big concern where nations need to sit back and look. And this year's theme is "The Evidence is Clear, Invest in Prevention." You know, just reading through it, someone said something about the fact that the theme aims at teaching, you know, countries the importance of understanding effective drug policies and stuff like that. And, you know, looking at Nigeria, the question begging to be answered is how effective are drug policies that we have, you know, presently right now. Anyways, that will be a topic for another day. I have personnel from Youth Rise Nigeria, and like I told you, that they were coming in earlier on, and we'll be discussing about the World Drug Day. And like I told you, they're big on advocacy for removal of stigma, and that's the perspective we'll be taking this discussion today in order to mark the World Drug Day. And joining me in the studio this afternoon is Mrs. Owoyemi Boluatife, who is the programs manager of Youth Rise. Good afternoon.
Good afternoon.
You're welcome.
Thank you.
And also Mrs. Precious Ayanwu, who is the advocacy and policy lead, is here with me. Good afternoon to you.
Good afternoon.
How are you doing?
Very well.
Welcome. And Taye Omowumi, who is the communication and strategic information officer, is also here. How are you doing, Taye?
I'm fine. Good afternoon.
Welcome. Thank you guys for joining me. And do I say happy World Drug Day in arrears or something? But then to start with, right, can you tell us what is meant by stigma in the context of drug use? I know you guys are really big on stigma, its removal in the fight against drug abuse and all of that. So what is this stigma thing that we keep talking about?
Okay, so thank you so much for having us.
You're welcome.
Stigma is basically when you see someone in a negative light. Mm-hmm. So the word stigma happens to basically anybody, or it doesn't have to be with just drug use alone, but basically stigma is just when you discredit a person. It could be because of certain characters, it could be because of race, it could even be because of the person's states, and you just feel like, oh, this person is from this state, I'm just not going to associate with you. That's just stigma,
right?
Yes.
But okay, yeah, I mean, I've always, you know, had to deal with that word. I mean, I remember when the campaign was on with HIV and the likes of them, a lot of stigma issues were also raised in order to help people who are within, you know, that point where they're having to deal with that. But yeah, thank you for helping us clarify stigma as in the context of drug use and, you know, other wider issues too. But what evidence demonstrates that reducing stigma leads to effective drug prevention of drug use? But before we even go into that, right, I want for us to talk about the World Drug Day. Why is it significant that, you know, such a day is kept aside to be marked, basically? Because someone want to ask that question. Why is it so important?
Well, I would start with saying drug is all around us, and it's basically in our day-to-day life. Most times when we talk about drugs, people just quickly imagine illicit drugs. But I mean, alcohol, caffeine, they are all drugs.
They are all
right?
drugs.
So the fact that drug is all around us and people have reasons we may not agree with, but they have reasons why they use drugs, highness, recreation, whatever, has led to the fact that drugs is now so much in the society that is bringing up a lot of public health issues.
Yeah.
So in Nigeria, we have a number of 14.4 million people who use drugs just in Nigeria. So
That's a lot.
Exactly. So imagine what the global statistics of people who use drugs it's like. So it's important that the world generally come together to say, okay, how do we address this issue that is within us? And beyond the drug use, we also have the supply area where people and big syndicates and all have formed an organized crime, drug trafficking, which have led to other forms of trafficking and other social vices, right?
Yes.
So that's why it's very significant that the world comes together every year on 26th of June to reflect, to say, okay, what have we done so far? Have we been able to meet our targets with drug reduction? How can we improve? What are the evidence we've witnessed in the past? What can we leverage on to grow further? That's basically the significance of what drug.
Okay, that's very, very important that we get to clarify that. But you know, like Mrs. Bolu Atife, I was talking about the theme for this year's celebration of the World Drug Day. It says, let's see, what's that again? The evidence is clear, invest in prevention. You know, first of all, I want you to speak to the theme of this year, and then also, how well do you think we as a country, as a people, as a society, have we done in terms of, you know, waging a war against this drug use, as your colleague has harped on?
Okay, thank you so much. Evidence is clear, invest in prevention is actually, the team is actually speaking on, there are other measures that have been put in place in order to, you know, reduce the effects of drugs, particularly on young people. So this time around, researches, studies, people have just come together to say, oh, why not focus on prevention? Prevention is saying, so for those who have, should I say, factors or reasons to want to use drugs, let's put in measures that takes them away from drug use. Yes, so that's why we're talking about prevention now. So there's been treatment, there's been policies, there's been programs in order to reduce drug use on those that have already started using. So now we are saying for those who have not even started at all, let's put in preventive measures to say, okay, this way we get to see more clearer results and we get to see this thing, you know, play out in our community. And as far as what Nigeria has done, I mean, Nigeria has done a great deal because we have policies, we have civil societies, different people coming together to speak on various issues affecting people who use drugs. So in terms of prevention, the Nigerian policy mostly focuses on
punitive, punishment.
Yes, exactly. And it's very obvious that this is not working.
It's not working
because you have more and more people, particularly the young ones, even as far as the junior secondary school, getting to use drugs. These punishments are there. They are aware that they can be arrested. They are aware that they can be thrown in jail, but they still get to use those things. That's because there are other factors that are influencing this use.
Exactly.
And the punitive measure is not taking them away from this.
Exactly.
So I feel like if we focus more on the reasons why they're doing this, that's what the preventive measure is all about. Why are you using drugs?
Why are you using it? That's very important because that's like tracing it from the roots, you know, the root cause, and then dealing with it from there rather than, you know, just cutting it off and saying, you know what, you know, you heard recently when the House was saying that we're going to prescribe how many years imprisonment and a whole lot of things. And I'm like, okay, so we've done this over and over and over again. How much reduction have we seen in terms of drug use? I mean, from your statistics, is quite whooping to hear that.
That was at 2018. So who knows?
That was at 2018. Exactly. So who knows what the exact number right now is? You know. But let's look at some of the issues. What are some of the driving factors that causes people to go into drug use? We'll still come back to the issue of the stigma. But I want us to talk about these issues because we need to have a clear understanding of this very issue that is a big concern in society, and then we can also talk about the stigma.
Okay, so people handle things differently, right? So what we might think is a predisposing factor for A may not be for B, but the reality exists that people go into drug use for various reasons. We have poverty, we have unemployment. If you drew a quick check between the core rural areas and the places where, they have opportunities to go to good schools, have good influences around them, you see that the people who are in the core rural areas are more predisposed to go into drug use early. We have houselessness. Some people are homeless. They're on the streets. How do they survive every day?
These are factors still around poverty.
Factors around poverty. Beyond the behavioral need, beyond the fact that sometimes people just want to use drugs to, stay happy, stay high, up to. But then there are other factors. Pain management.
Yeah.
Some people actually get into drug from, taking pain management drugs, and before you know it, they're addicted. There is addiction on its own, right? So, a one-time trial and then the person is hooked.
Okay, so for example, like these are prescribed drugs that people take. And
yes, people can actually get addicted to prescribed drugs, especially opioids for pain. Probably a cancer patient, somebody who has undergone a very severe surgery and has been prescribed drugs to manage the pain. There are, public health practitioners who are actually hooked on drugs that they have access to. So there are a lot of predisposing factors, like I've mentioned. There's pain, there's depression, there's mental health issues, there's hunger, there's environmental issues. Do you know, the funny thing is that I've heard someone say that, I don't know if you know of eyes, Rumi.
That name makes me laugh every time I hear it.
The reason why she does eyes is because it helps her to stay should I say not hungry until she can afford to eat.
Oh dear God.
So you have one square meal and most likely at night. Yeah. So I take eyes in the morning so I'm not so hungry and I can go about my day before it's night. So there are a lot of predisposing factors. And like she said, talking about prevention is let's look beyond the surface. Let's look at the things beneath. Some of them is just illiteracy. Some people are not educated. They don't even know the components of what they are consuming.
Yeah, that's consuming, exactly.
This person is taking it, she's high. Let me do the same, basically. And they are hooked. Let me allow my colleague to
just to add a little to what she said, sometimes, apart from we know young people like to experiment. We are very, if you tell us this is what will happen, we want to know, we want to experience it, like, oh, is she telling the truth? Is she not telling the truth? So one of these predisposing factors, like she mentioned, is the fact that information out there about drug is not complete. It's not complete and it's not accurate. I'd like to just give a personal experience. I remember when I was younger, there was this man on the street, and every time we hear the tobacco advert of smokers are liable to die young, we remember this man who has been smoking for a long time, and he's 97.
97?
Yes, 97.
Oh dear God.
So that contradicts what the information we are getting and what we are seeing. So giving accurate information too is also a very good thing, because they know that, okay, this is what the reality is, not doing a diluted information just because you want people to stay away from this thing, and you say, if you do this is this, and this
say
is
no to drugs.
It has not worked.
I feel they beautify the content of it that's online, that's in media. They beautify it. They don't go deep into analyzing that's the public health issues that comes from using drugs. So I guess that's where the
well, these days, they seem to glamorize everything negative, especially on social media, and so it is increasingly becoming a dangerous place. As much as it's very beneficial for a lot of things, it's also becoming a very dangerous place where you get to see people glamorizing, magnifying all those things. Before, when we were growing up, you could not even hear some sort of discussions coming up in public circle. But these days, people are proudly telling you that I do this and I do this, and so what, Anyways, that's the topic for another day. So, having explored the basic things, from the, drug use to what the society is doing, the causes that makes people drive them into drug abuse and all of that. We now come to the issue of stigma, and I think it's part of one of the things we get to see in a bid to like show that I don't you use drug, I don't want to have anything to do with you, like you explained to us, Mrs. Bolotifi. So let's also talk about the evidence that demonstrates that reducing stigma leads to more effective prevention. First of all, do you agree with the fact that when you reduce stigma, it becomes more effective, or
Yes. Oh,
and then
yes.
so also what is the evidence of that?
Okay, so let's bring this to our daily life now. If I go to, should I say an hospital or even a supermarket to buy something, and I get a negative attitude, or I perceive that, the attendant is giving me a nasty attitude, I wouldn't go back there. No matter how much I need what they're selling, I will stay away from that place. So that's the same thing with stigma. Even though in cases where you have people who use drugs who need help, who have admitted, come to that part to say, I need help, they won't be able to seek that help because of that notion that this person would treat me this certain way. So that is the effect of stigma on preventive measures, and then even reducing the entire drug use epidemic.
I think another very good example would be the progress we've had with HIV itself. I don't know if you can look back, 50 years ago, 60, 100, there are times that people who had HIV would rather die than tell their families.
Yeah.
Because once you open your mouth to say, I'm HIV positive, they
Everybody
probably lock
avoids
you
you.
up somewhere. And they just avoid you.
Yes.
So there might be treatment available, but I'm scared to say I have HIV. The same thing happens with drug use. In the way we've painted, drug use, the way we perceive drug use, which is not exactly people's fault, but because of the way it has been projected. When you hear drug use, sometimes you think criminal. You think junkie. You think somebody who has no future.
Yes.
Dirty, tattered looking.
Tattered. So, just imagine yourself in a family setting and a first son of a very renowned family, and he has a drug problem. The first thing the family is thinking, you're bringing shame to us, this, that, and they try to suppress the person. So because of these things, people who actually need help, who know that they need help, who don't want to come to surface, they don't want to be associated with that stereotype we have created. But if we take away that stereotype, just like we've been able to do so far with HIV, people can now go to hospitals to say, I was exposed to HIV. Can I get PrEP? Can I get PEP? I think I'm positive. How do I enroll in treatment? The same thing, I believe, would actually happen in instance of drug. When people know that, I can walk into a health center and say, I'm having a drug problem, I need help. And they will admit me, treat me like a person, give me the treatment I need. I believe that's going to go a long way to help people who use drugs.
You're talking about treatment. What does that mean? Do people who have drug issues get treated?
Yes, because drug use, exposes people to a lot of factors. So it could be mental issues. It could even be financial issues, legal issues, and all that. So treatment is, specific to the person's needs, the person's issues.
Okay.
Yes. So treatment could be that the person needs some psychosocial support. Treatment could mean that the person just needs family support to say, we are here for you. How do we help you out with this? Treatment could be could come in the form of financial management. Okay, so when you have funds is what prompts you to want to use drugs. How do we help you manage the funds that get to your hand? So treatment basically comes in different form depending on the needs of that person.
Treatment could also mean helping you to ensure you don't overdose.
Yes.
That's death, basically.
Yeah.
So that could be treatment.
Exactly. I know of someone we grew up with, the person just died and it was OD. The mother went to the room and found him there, with all the drugs scattered, and that was just the end. And it's kind of very pathetic that it's still a major problem. But then, how can advocacy work with media, all the relevant stakeholders and all that, promote more accurate and compassionate perceptions of drug use rather than, focusing on stereotypes?
Okay, let me start then. Advocacy is basically giving a voice to people who would ordinarily have no voice in the room, right?
Yeah.
So if we are talking about how advocacy would work with media, how it's going to work with other stakeholders, it's basically bringing those stakeholders to the place where people who use drugs is to say, oh, these are people, these are human beings. Yes, they use drug, but there is a people before the drug use.
Exactly.
And let's begin to look at it from that perspective. The for instance, I think there was a time where we couldn't have this conversation on radio. But the fact that we are having this conversation is because there has been advocacy over time in Nigeria, right? And people are beginning to open up to the different perspective of drug use. Oh, now you can talk about the public health aspect. That's because somebody sat down to see it happening and then decided to bring other people into that perspective. Let's look away from criminality for a while. Let's bring it home. That's basically what advocacy is. So how we can use that tool is to just keep talking, keep engaging, keep presenting evidence, keep presenting the right narrative, correcting misconceptions online and offline. That's basically.
All right. Don't worry. We'll quickly have to take a commercial. Then when we come back, we get to hear from you, Taye. Right. You guys are listening to 95.1 Nigeria Info, and we are having discussion on how, we can take away the word stigma in our drive as a society, as a people, to fight against the drug menace or, the drug abuse that is very, very prevalent in society. Don't go anywhere. I will come right back after this.
More conversation, more talk, more right after this.
Hi everyone. My name is Swat. That's the name my father gave me, but you can always call me Her Vocal Majesty. I'm the host of The Sunny Side on 95.1 Nigeria Info. It takes place every weekday, noon to 3 p.m., where we get to have all the lovely contemporary conversations. If your days are normally long and gloomy, well, not anymore, because I'm here to make it all bright and sunny for you. So join me. It's an invitation. You don't want to miss out.
This is Nigeria Info. Nigeria Info. This is Nigeria Info. Nigeria Info. This is Nigeria Info. Nigeria Info.
Day, and we're having discussions around that very particular day with the theme, the evidence is clear, invest in prevention. We'll still come back to the theme and still talk some more about that. And I'm seated right here with the staff of Youth Rights, an NGO, a CSO who is actually in the forefront of fighting drug use and drug abuse, right? And also taking away stigma from, the whole notion of the fight against drug abuse. I have Mrs. Owoyemi who's a programs manager. Mrs. Precious Ayanwu is the advocacy and policy lead. And Taye Omowumi is a communication and strategic information officer. Taye, wanted to add into, what Mrs. Peace was talking about before we went on the break.
Yes, to buttress in advocacy collaboration with media, I would come in the aspect of language.
Okay.
Their choice of language to what they project online. There are some deterioratory words they use to, describe people who use drugs, and that sets a wide interpretation of what drug use is about. And I think that is even the major problem we are having right now, because most people don't really understand what drug use or people who use drugs. That's where the stigma starts from, because of the language
choice of words that they use in projecting. Exactly. I think it's very important, because when you say no be like that, certain words that we can't even call on air, describing people who use words already, they just feel more stigmatized, more afraid to come out because society has a perception. And honestly, we need to work on that as a people. It's not only with drug use. There are certain kind of people in society that are stigmatized and who could actually get a lot of help if only society would let them come out and speak to the issues that they're dealing with. But no, you just push them out. No, don't come near me, with a 6-inch pole and stuff like that. And then thereby driving people more into self-destruct, habits and all of that. But that's a very, very important one, Taye, that you actually added there. So how does stigma affect individuals' willingness to seek help or participate in prevention programs? I think we've even talked about that. But then you may just want to add a bit on that.
Okay, so like you said, we have touched on that a bit to say expectations that negative attitudes or negative words would be said to such person might deter the person from seeking help, and then also family isolation as well. Like Precious mentioned earlier, the thought of saying, "Oh, you have brought shame to the family," and then using certain languages or words rather to label these people would also make them, retreat further into their shells and rather not come out to seek treatment, because if it's going to bring shame to the family, if it's going to make me be judged, if it's going to make me be isolated from family functions, family events, if it's going to affect my job, if it's going to take away my child from me and things like that, I'd rather now come out and say and just stick with my problem. So that's one way stigma, deters them from seeking
coming out to
treatment.
Mrs. Peace, you want to add to that?
Well, let's look at it from the policy aspect, right? So I believe also the policy, the laws we have also places some kind of stigma on people who use drugs.
I was even going to come to that though after that, but then go ahead.
So because it says if you're using drugs, you're a criminal. And that's a strong word. That's a strong word to define a person. And that word can make you shy away from whatsoever treatments are available, because what is promised me is probably arrest, probably detention. If it's not arrest by the police, my parents can bundle me into a rehabilitation home and have me chained to the bed, have me flogged, have me beaten. Then how about women? I mean, it's even okay to think that men use drug. Now imagine when...
No, it's not okay.
I mean,
there's a general perspective.
In a balance, when a woman now says I use drug, the stigma is way more. I mean, there's a way society expects women to be, right? The way we are supposed to sit, how we are supposed to dress, how we are supposed to work. And the moment you're shifting away from that standard, you are attracting some kind of hate.
The wrath of the society. Exactly. They come down on you like haters.
So that happens. Like she said, it deters people from seeking help. If I'm a woman and I come out and say I use drug, come on.
But surprisingly, I don't know, this is a person, I have not done any poll, but I know that a lot of women, a lot of young girls are increasingly getting into this space, of drug use.
Yes.
Because of so many factors. I know you've mentioned them, but some cultural things that are driving people crazy, like to numb the pain of expectation, of the judgments and stuff like that. It's quite unfortunate, and for the fact that this stigma is still a big issue, many more, unfortunately, might just still go down that pace. But then let's look at, community-based interventions and how effective that can be in reducing stigma and then supporting also prevention efforts. How can, these community-based efforts be put together to help?
So oftentimes people focus more on what will people say about me.
Yeah.
So if I come out, what would this person say?
Yeah.
What would be said about me in my street, in my women group, in my church, and things like that. So that's where the community intervention comes in. When there are options when there are measures for people to, come out, seek help within their community, it actually helps a great lot. And one of these measures can just be a group meeting where people just come together and share their experiences. And from there you can see that, okay, you have overcome this way. I can borrow from your experience to heal. And so community intervention also helps to, structure those things in a way that fits this person, because there are different cultures, different social beliefs and all that. So community intervention makes it fit into what different cultures can allow, and then it becomes relevant to the people themselves seeking that help in that community.
Okay. Indeed. All right, do you want to add something?
Yes. Also, like what she said, that's Mrs. Precious, what she said earlier concerning rural areas. If you bring campaigns, because ignorance is not an excuse, but knowledge is wealth. So when you create awareness using campaigns, go to communities, tell them, oh, this Obi is a boy. We all know that, but we want to tell you that beyond Obi being a boy, these are other features that makes him a boy. I'm just using that as an example. So that's what I want to add to it.
Okay. All right. That's very interesting. So, like I said, I wanted to come back to the theme, like reading through the theme and what the intent for, putting up that theme, the evidence is clear, invest in prevention. One of the things that is being said is that the theme aims for countries, to get the importance of understanding effective drug policies that need to be grounded in science, research, compassion, and full of human respect, which speaks to the issue of stigma that we're talking about, because stigma takes away the, respect for human rights. We treat them anyhow, like animals. In fact, like you said, they bound them and chained them in instances and stuff like that. So, how much of the scientific methods have we seen, even if not at the government level, but maybe among CSOs that we're seeing working on issues related to drug use? I mean, have we seen anything of that, sort, scientific innovation that is aimed at helping people who use drug?
Okay, so one of such methods that has actually worked is the support group that I mentioned.
Okay, yes.
Yes, people bringing people with same interests, same experiences together is actually a very good form. Helps them to open up, helps them to learn from each other's experiences. And another one is, earlier we mentioned that there are various underlying factors to why people use drugs. So one of such methods is addressing what that underlying factor is. We cannot use a one-shoe fits all approach for people, because people use for different reasons. So evidence has had it that when you address what makes this person uses drugs, you get to see results even in the productivity of that person. And then also there are improvements, or success is measured differently by different individual. For success, for one person, success can mean, the fact that you do not OD, the fact that you know your limits on drug use. For another, success can mean total stoppage of drug use. For another, it can just mean knowing how to not expose yourself to contracting, to other risks, to contracting HIV, to contracting, various other bloodborne diseases that maybe for people who share needles or something like that. So success is, relative to different people. Depends on what the presenting problem is for each person coming into.
Okay.
I think another evidence-based programs that has been implemented all over the world, including in Nigeria, that has helped people, is focusing on reducing the harm associated with drug use.
Okay.
Just like she mentioned, focusing on ensuring that people do not OD, people do not get other infections like HIV. People who inject do not get abscesses that make them cut off their hands and all that. So while you're focusing on reducing the harm that they may be exposed to, I mean, there's a way handling harm can actually make you see the things you are exposing yourself
Exactly.
to. And then you begin to take steps backward
Yes.
to help yourself also stay away from that harm. So focusing on reducing the harm that is associated with drug use is very good. It's one of the interventions that all over the world that the global village keeps prescribing. Okay, let's help these people stay away from harm while we are working on the whole drug use. So we don't say, drug use is drug use and people are getting HIV, people are getting hepatitis and all that. So
yeah,
that's
interesting. So
Okay, yes, also the scientific evidence that you said CSOs has also shown is some CSOs has project the drop-in center where people who use drugs can be given proper orientation on harm reduction strategies. Okay, you've been doing this thing consistently. You can do this one day off like that. And also in that drop-in center, more vocational skills are given to them so that they are not idle. They have something doing. And that way, it takes them away from their usual practice of using those substances.
Indeed. That's very, very important. I think there's this one that they call it Alcoholic Anonymous. I know that that's
a support group.
Yes, a support group. Yes.
We need to start looking at communities beyond the structural settings. Communities can be people who share the same, like she said, the same behavior, the same ideas. So if it works for Alcohol Anonymous, where people even get stars for staying sober, they give them chips for staying sober. They come and talk about the internal pressures they feel towards that drug, and they get advice from their peers.
Yes,
that same thing can be replicated, and it's being replicated. We call it peer support group, right? So
that's very, very good. Okay, so if you want to be a part of the conversation, please feel free and begin to dial the number 0700 951 0000 and 08095974869. WhatsApp is 08095974869. We're streaming live on YouTube and Facebook. You can drop your comments and your thoughts there, by the way, so that we can have your feedback and response to this conversation we're having this afternoon. Let's see who's here. Hello.
Hello, good afternoon.
Good afternoon.
I compliment your guests that done wonderful work on this topic this afternoon.
All right.
I appreciate them. Yeah.
Thank you.
I just want to, my name is Edward anyway.
Okay.
I just want to suggest to them that they should please take a little step forward in Abuja area, especially some of these places popularly called the Benguin, in places like Mabufu, Tako, Jadi. You will be shocked the number of drugs being consumed in those areas. In fact, some of the girls there, they pretend as wearing hijab and wearing crosses or those over their body, and they're into it. In fact, in most of the hotels around these areas, they just hang around there and then look busy almost all the time. I don't know whether it is necessary for them to go there. I mean, share flyers and let them understand the risk and the dangers involved in engaging themselves in such activities. If that can be done, it will help us in Abuja so that crime can be reduced. Some of these guys are the ones who are terrorizing the cities. Once they get high up, they don't fear anybody, don't fear gun, don't fear knife. Even if I ask them to do that, to go and kill, they will get up and kill. So we are also concerned because the dangers they pose to all residents in Abuja. That's on one side. Then, in my own village, I have all these guys like that, people in the village who are not engaged and they're involved in some of this smoking of smoking of
Okay, the network is not so clear anymore. Sorry. You may want to call back. Let's call back so that we can hear you. Hello.
Hello.
Good afternoon.
This one, good afternoon.
Welcome, ma'am.
How are you?
I'm fine.
I'm watching four beautiful women in the studio.
Okay.
I think I'm supposed to be the fifth person, but I'm far away. Well done.
All right, thank you. Welcome.
My name is Mrs. Omeza. You know me, I be local person. Make I use the one way go easy for me to speak. With the success story, when our sister talked about it, means if I have a husband, alcohol is no doubt about it. He takes alcohol and comes later what it means I will not be fighting him to stop it totally. If him to reduce like
the network is bad. Oh.
Came from. I'll call back.
Okay, please call back. Okay, what is it?
She's trying to say that, perspective of what success for her husband, for a husband who drinks and doesn't come home, could be not stopping, but drinking at a proportion where he's not, lost.
Okay, all right.
So knowing the limits.
So instead of fighting him to stop drinking at all,
Hello.
why
All
not
right.
engage to say?
Yeah, hello, good afternoon.
Good afternoon, please. Do you mind if I don't use my name?
All right, go ahead.
Yeah. I've been using drugs for almost 38 years now. Hard drugs. But I work. I have a family. I maintain myself. I have a business. But it started since I was 17. Now, I'm pretty old at the moment now, but...
Please call back. Call back. We need to hear what you wanted to say. It's really important we get some of these people, anybody who wants to share experiences, to do so, because it will help lots of other people. Like what's saying, stigma is the issue with, one of the major issues in society that hampers this fight against drug abuse. So if people are able to come out with their stories and people feel inspired, then why not? Hello? Hello? Okay, I think that's a network problem. You can also send in your messages, and I think I saw a couple of messages on our Facebook page. Let's see. This one says, also Francis Namani watching live from Amakuze in Enugu State. Good afternoon, Swat, and my guest in the studio. The issue of drug abuse is really alarming in our society today. The National Drug Law Enforcement Agency should rise up to their responsibility to curtail the excesses. Okay, thank you so much. Hello.
Hello, good afternoon, Auntie Swat.
Good afternoon.
And good afternoon to your guest. What work they're doing. I commend them.
Go ahead.
Yeah, the use of drug, or the abuse of drug, has become really, really endemic. Myself, sorry, I don't want to mention my name, but I've had to use drugs at some point. What some people will classify as gateway drugs. Like, I don't want to mention the name of any drug, but I've not used really hard drugs. However, at some point, I have had to take a lot of risk, when I was high. Meeting up with strangers that I have never met before and doing very intimate things with them. Risking personal information and all of that. So I would say from personal experience, it has been very, very sad one, because I'm not proud when I think about it.
All right.
Still trying, working hard to get off, but I think it's going to be a gradual process.
All right. Thank you so much. Thank you for sharing your story. I think it takes a lot of boldness and courage to do that. Hello? Okay, drop a call there. Call us back. Let me see other messages on our WhatsApp and all the other platforms. It's already 1:47. So let me see. Okay, let's see. Hello?
Hello?
Good afternoon.
Yeah, good afternoon. Auntie Swat.
Yes, okay. We can hear you now.
Now, wow, WhatsApp call. My name is Mrs. Obeza. I've talked about our attitude, some of us women, that our husbands are into, and
Hello. Okay, Mrs. Omeza, this network is not friendly to you today at all. We do apologize, but I mean, you guys had some of the comments already. I mean, you want to chip in a thing or two? Any comments you want to throw in?
The caller who identified and so for the first one who mentioned the productivity, mentioned work, children,
And
family,
business, his management.
it's for me, I would congratulate that person. Here's why: because the person still remains productive amongst this all. Like, yes, you admit that the drug use is a problem, but the fact that there is that clear productivity, the person is still able to keep his work, is still able to manage his family and the society. I think that is a clear progress. However, he can still make efforts to address the drug use problem, but the fact that he's not allowing it to interfere with his productivity is very
It's something
good.
to commend.
And also for the caller who said it's a gradual process. Remember earlier I mentioned that success is different for different individuals.
Yes.
For some persons, success can be just admitting you have a problem.
Yes.
That's a very great step, because if you're still in denial, then how do you seek help?
Exactly.
So admitting that, yes, you have this issue and you admit that it doesn't just, a baby doesn't run in a day. It still takes baby steps. So admitting that it's a gradual process, it's actually a pathway to healing already. So that is just a very good.
Indeed.
Okay, I would want to draw a comparison again between the caller that is productive and the first caller who made a comment to say, oh, look at the people in this area. They're the ones constituting crime, they're the ones causing all the nuisance in the environment. Yes, people who commit crime use drugs. But it's not everyone who uses drugs that is a criminal.
Yes.
We have two instances now, right? Somebody has a perception that everybody who uses drugs constitute nuisance in the environment. And then we have a caller saying, I have my business, I have a work, I have a family, I'm a responsible person in society, but I use drugs. I just want to bring out that two picture so that people could see that there is no one shoe fits all in this conversation. It's not everyone who uses drugs that is on the street.
Yeah, it's on the street. Indeed.
Some people are, it's reality.
Yeah,
It's
very,
just
very
reality.
important. Very important. Hello?
Hello.
Yes, good afternoon. Welcome.
My name is Abdul, calling from Derby.
Okay.
Yes, actually, I commend your own guest to be there and make a awareness. This awareness, I don't think that it should stop for those people that have been addicted into drugs or those that are affected with the HIV virus. Even the parents, they're supposed to be informed all those things. I wish they are listening to Nigerian Info. Most of their children, those elite people that their children found themselves into drug addiction, they've been isolated from their parents because of one thing or the other. They should be one of the first child or the second child involved into all those kind of things, and they now be thinking of let them isolate them for anything that is involved the family and school and all those things. That is the reason why sometimes the child being provoked and find other guys that they are into this service to be his own friend, and along the line he would even pack his own things and leave the house to go and start living in other places that he's not supposed to be there. After all the necessary things that one is looking from the parent, he has it. It's because of that stigmatization from even the members of the family that cause all those things. So I think it's a very important this year, I guess, that they have come up to start informing people in the form of awareness. Let that be even inspiring, not to keep their own child or their own girls that they found themselves into these things. So that is going to be very interesting for them to know that yes, other people they reject their family, but others, this is the step that they take on the respect of awareness, and their children today they have already dropped all the drug addiction. They come back to their system. I think I commend the program. It's very important. Thank you very much. Keep doing what you are doing and do it very well.
All right. Thank you, Abdul. Hello.
Hello.
Yes. Good afternoon.
Hi, Swat.
Yes.
Yes, we got cut off earlier.
Oh, okay. Yes.
I'm person that, yeah.
What is happening? What is happening? Okay. I mean, he wants to tell his story. He's a guy who started, talking about he uses drugs, but he has a family, blah, 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 and all of that. I really wish the phone lines would stay, but he keeps calling and he keeps going off. I'm really sorry about that. Really, really do apologize. I wish you could call back so we can maybe use any other number. Maybe you can use a WhatsApp 080999, and our time is so well spent already. 08099930 That's the WhatsApp, and 08095974869 or 0700-951-0000. I don't know which one you're using, but try alternative numbers. Hello.
The network is it hello?
Yes, we can hear you now. Please go ahead before it cuts you again.
More on true. That our children have started taking substance. Because some of them, you see them withdrawn at home, they don't talk. But when you are away, they do all sorts of things. And we have cheap substance in the market that they take it, and those substances are destroying brain and water. So please, I want them to dwell on the attitude of women towards husbands that are doing drugs. Then how do we discover that our children have started taking drugs at early age, so that, and how do we react to? Because I have a colleague that told me that his son will always take part of the rice and go sell the rice to buy certain things that he was taking. So when he discovered, he started beating the boy. This is somebody that is less than 17 years old. So when he told me, I said it's not beating that will bring him back. So I want them to, please, before leaving, at least talk to parents.
Okay.
More news and information coming up. We'll be back in a moment.
Hi everyone, my name is Swat. That's the name my father gave me, but you can always call me Her Vocal Majesty. I'm the host of The Sunny Side on 95.1 Nigeria Info. It takes place every weekday, noon to 3 p.m., where we get to have all the lovely contemporary conversations. If your days are normally long and gloomy, well, not anymore, because I'm here to make it all bright and sunny for you. So join me. It's an invitation. You don't want to miss out.
This is Nigeria Info.